Vicky Fox.
Thank you, Madam Deputy Speaker. And I thought I might just start by touching on a bit of kind of what my motivations are. When I was first elected in 2015, in September of that year, I had to deal with losing 2 young men in my constituency very quickly. I saw the impact that this had on the whole community. And since then, we've lost 10 young people in Lewisham, Deptford. But with 130 lost in London and 263 young people lost across the country this year alone, it was clear to me that this was not something that we could simply tackle in Lewisham, Deptford alone. But it was also clear that if this many people had died in a football stadium, a music arena or a workplace, we would have been having a national inquiry. And in conversations that I had with experts and young people, I realised 2 things very quickly. One, anything we did, it needed to be cross-party. We can't play politics with young people's lives. And 2, it needed to be evidence-led. So that's the reason why we went and established the cross-party commission into the root causes of youth violence. And Warwick University joined as our academic partners and academics from elsewhere, including the Open University, who supported our work. And in developing our interim report, our key recommendation was a public health approach. Now, far too often when we talk about the public health approach, people, and in particular politicians and commentators, say those words, but they don't understand what it means and where it came from. So, in 1996, at its 49th annual conference, the World Health Organization declared violence a major and growing public health concern around the world. And in 2002, the World Health Organization advocated tackling violence as a public health problem. And what they identified is that violence was acting and spreading as a disease. So the focus is dealing with violence as a disease, just like any other disease, because their evidence showed that violence spread like a disease, and as such, we need to treat this disease and prevent it from spreading. And across the world, there are numerous examples of successful public health programmes tackling violence, from Chicago to Scotland. And I could name loads of them, but I've had to dramatically cut down my speech to try and stay within time. But Cure Violence, founded in Chicago in 2000 under the name Ceasefire, runs projects all over the world, including projects in England at Cookham Woods Youth Offending Institution. And this resulted in a 50% reduction in violent incidents, a 95% reduction in group attacks, and a 96% reduction in youth involved in group violence. And Cure Violence maintains that violence is a learned behaviour and that it can be prevented using disease control methods. The Cure Violence model has 5 required components. 3 are core and 2 are implementing components. Put briefly, the model involves 1. Detect potentially violent events and interrupt them to prevent violence through trained, credible messengers. 2. Provide ongoing behaviour change and support to the highest risk individuals through trained, credible messengers. 3. Change community norms that allow, encourage and exasperate violence in chronically violent neighbourhoods to healthy norms that reject the use of violence. 4. Continually analyse data to ensure proper implementation and identify changes in violence patterns and levels. And 5. Provide training and technical assistance to workers, programme members and implementing agencies. And in Scotland, the Violence Reduction Unit that was established in 2005 has reduced the number of homicides by 39% and violent crimes by 69%. And this is huge, and I could literally talk for hours about their work, but I won't. But I'm going to be far more simple in what I say here. And this is not about having nothing other than total respect for the work they've done and the magnificent people I've met. It's absolutely the opposite. Karen McCluskey and John Carnacan, who set up the Scotland Reduction Unit are two of the finest, most dedicated people I have ever met. And this has never just been a job to them. They drafted the Violence Reduction Unit's first plan, and they would say they had lots of dedicated people who worked with them. And I know this to be true. And what were the main things that they would say to me if they were here? It's about relationships. And this I interpret to mean breaking down barriers, pulling people together on a common aim, enthusing people to do something that's going to work, but also about the importance of individual relationships. They would also say, follow the evidence. Don't do things that don't work. Do things that work. And sometimes this might mean trying something, realising it's not working, binning it, and trying something else that will work. They'd also say, listen. Listen to what you're being told, what the evidence shows you. Listen to our young people and recognise that they are so often so very vulnerable, even if they put a super hard act on. And one of the most important things I think they would say is it must be long term. They had a 10-year strategy, but when you speak to them, they say it could and probably should have been 15 or 20 years long. Now, in London, I'm glad to see that Sadiq Khan, the Mayor of London, has announced the establishment of a violence reduction unit in London, which will establish a public health approach to reduce violence, learning the lessons from Scotland, but appreciating it may need some different approaches in London. But we need local authorities to have that legal duty. And that's not just about having a consultation on the legal duty, but the absolute legal duty to underpin a public health approach in tackling violent crime. And I hope the Home Office can update us on this soon. So coming back to the government and what the government can do. Well, as we've already said, we need to learn the lessons from what works. And we need to be brave and follow the evidence, which can be difficult when the government does not store data on crucial sources of information. So, can the Minister tell me why the government does not hold centrally data on the time of knife attacks, especially when recent research has shown us that young people are especially vulnerable between the hours of 4 p.m. and 6 p.m. on school days? The number of knife-aggravated murders in each city or local authority is also not held centrally, and this makes it far harder to compare the efficacy of different local authority approaches over time. The number of prisoners that were excluded at school is also not regularly recorded. Now, many victims of knife crime do not report their injuries to the police. Should this not be something where we're looking for this information in other areas, such as the NHS? Also, the government does not cross-reference ambulance service dispatch data for knife injuries and police records for knife attacks. And when many people believe there's a link between deprivation and levels of violence, why doesn't the government hold this information? And finally, but extremely important, why don't we record the number of young people that applied but failed to meet the threshold for child and adolescent mental health services treatment? Now, these are all extremely important areas, and I'm sure there are many more that aren't covered, where we should be holding this data as a minimum to ensure that the government can successfully deliver on its public health approach. Now, I've asked numerous questions of the government and others to try and find this information, and sadly, I know the government doesn't hold this data. Now, why is this? And will the government commit today to seek to hold this data? Secondly, why do we invest in programmes that we know do not work? For example, there is no evidence to suggest that programmes in schools that say do not use drugs or do not carry a knife have any impact. We should analyse the efficacy of these programmes, and if they do not work, we must stop doing them. But we do know that programmes investing in social development, home visitation, training and parenting, mentoring programmes, family therapy, we know that these do work. We also know that the earlier the intervention, the more effective it is. Right, I'm going to go and skip through in terms of ACEs because I know that other members have gone and said this, but I would say that it's an extremely important area of work and we do need to do a lot more on it. And I think that if all members of Parliament could go and do the survey on ACEs and go and get their scores, and this is something that I intend to go and do in the future. Right. The other thing on ACEs, I understand that the government is due to be publishing a report into ACEs. So do we know when this would be published? Okay, I am now skipping through schools, but in previous speeches in terms of education, I've mentioned a lot in terms of schools and what happens. And I do think that this is really important, that we do look at, are the finishing times right? Should we be staggering them? Should we be thinking about closing down all PRUs? Should we be really looking at our expulsions? Because we could absolutely invest that money far earlier on in terms of our children's lives. But I do really want to conclude my remarks with a quote. This is, to me, a very important quote. It's a member of the Youth Parliament, Sia Vyas, who spoke about the importance of tackling knife crime in the recent UK Youth Parliament debate. She said, "More young people voted for this issue than any other. If there is a will for change on this issue among young people, there is a political will for change here at Westminster. Whether we see the need for a violence reduction unit and a public health approach as pioneered so successfully in Scotland and endorsed here by London's Mayor, or the Home Secretary's recent proposals to increase levels of stop and search, this debate is happening now and we cannot neglect our duty to bring young people's voices into it." After this debate, and following a ballot of more than 1 million young people across the nation, the Youth Parliament and the British Youth Council chose this as their national campaign. Let's make sure that as politicians we don't let them down. Yeah.